and Healthcare is coming to you live from the Plateau Radio Television Corporation here in Jos. And you know that each moment like this is a moment of excitement and joy because we want to inform you, we want to educate you. You know that health is wealth. And when you are healthy, we are always happy and we are good to go. So today on the program, we are here again with another topic that we will talk about it, that we will discuss it, that will inform it, that has to do with, so many things surrounding the youth. And this time today, we are looking at the issue of, population and centering on sexual and reproductive health, because the 11th day of July is World Population Day, and the focus is on sexual and reproductive health. But we decided again to make it the youth and reproductive well-being, the youth and reproductive well-being. And with me in the studio is the person of Dr. Ayuba Namang Jehu, who is a resident doctor, anatomic pathology and forensic medicine, public relations officer of the Nigerian Medical Association Plateau State branch. You're welcome.
Thank you for having me. Good afternoon, our viewers. I bring you greetings from my chairman of the Nigerian Medical Association Plateau State branch and all members of NMA Plateau. I hope you are doing well today.
Okay. Yes, thank you for always making sure that here we are informed, especially anything that has to do with our own health. So, population, youth, reproductive health, sexual health, and all the likes. How are all these ones connected together?
Okay. Thank you once again. And I would want to give a background to this. The World Population Day, like you rightly mentioned, was commemorated on the 11th of July. And annually, it is commemorated every 11th of July. And this started since in 1988. In 1987, that was the first time, for the first time ever, the world population rose 5 billion. Okay? So before 1987, there was not as many as 5 billion people walking on the surface of the earth. Okay? So as at that year, the human population rose to that number. So we had 5 billion people, of course, scattered across the globe, different countries. As at in Nigeria, as at 2006, that was when the last population census was done. And the population of Nigeria then was 120 million people. As at today, 2026, 20 years later, Nigeria's population is estimated to be, although a census has not been done since the one of 2006, but the projection, the population now is about 240 million. Okay, so you can see that we have a very big number of population. Now, population distribution varies across countries, across region, and across ethnicities. Okay, what I mean by varies is that the population, the age groups you see in a particular region are not necessarily the same age group you see in another particular region. For instance, if you go to China now, there are so many elderly people in China and some parts of Asia because life expectancy there is quite high. And then there were birth control measures, that were introduced in previous years to reduce or to checkmate population. If you would agree with me that some 5-10 years back, China used to be the most populous country in the world. Okay, now China is no longer the world's most populous country. The most populous country in the world now is India, followed by China. And what brought about this is the fact that when the Chinese saw that the population was growing and it was going to outgrow the available resources at its disposal, they decided to bring about birth control measures so that they would checkmate the population growth, so that there will be equitable distribution of health resources, so that everybody would. Now, eventually, the population of young people or people that are being born reduced, but those that were around already were growing older. So now we have the population pyramid is giving, you know, you would do the population census, and then you will see that there are more elderly people than there are younger people. If you come to Nigeria, it is the reverse. Okay, due to some, economic, medical, social factors, people don't get to live to, um,
Very old age.
very old age. Sometimes due to lifestyle as well. Okay, so we have more younger people than the elderly people. Now, what I'm trying to say in essence is this: World Population Day has been set aside. When it is being commemorated, we study population and then we look at the patterns of population distribution. Then we look at the impact of this population distribution on the lives of human beings, okay, on the lives of people. Now, bringing it down to Nigeria now, we can say, okay, since Nigeria has a population of about 240 million people, how much of these people are youths? We said a bigger number are young people. Okay, now we can say, let's assume maybe 160 million out of the 240 are young people. That's more than 50%. Okay, so what that means is it is only appropriate that government make policies, okay, that focus so that more resources will be focused on young people, and then health, challenges that are peculiar to young people. So unless you study population, unless you know the population distribution, you will not know how to distribute your resources appropriately. You may end up taking the resources, a larger chunk of it, and then giving to the wrong people. Okay, take for instance now, let's say in China, supposing China begins to just invest so much on the younger people who are fewer than the elderly people. I mean, they will be it means the elderly people will be neglected. Okay, likewise here. Okay, so now this year's theme says realizing the hopes and aspirations of young people today and for the future. Okay, now you would agree with me that the young people are the workforce of every society. It is the young people who will man the military. It is the young people who will go to the farms. It is the young people who will be doctors. It is the young people who will be lawyers. It is the young people who will work in the studio. I'm a young person. Okay? Now, if this population is affected, it means the bedrock on which the society stands would shake. And then what that would have devastating consequences. Okay, so when we talk about realizing the hopes and aspirations of young people, now every of these young people have hopes. If you go out, for instance, and then you meet an average young man or a young woman on the street and ask him, what are your hopes and aspirations? Then you would see people talking about, I want to be a doctor. People talking about, I want to get married. Before I came to the studio, I was talking with someone and he was telling me that he wants to get married. So they want to get married, they want to have children, they want to raise kids. So you see, these are aspirations of young people. Unless the health of young people is attended to, these dreams, these hopes and aspirations will not be achieved. Okay, so what it means is this would go as far as affecting even the future and the productivity. So when we are looking at, that's why we are going to focus more on reproductive health. We're going to focus more on sexual health. and then we are going to focus more on issues that have to do with maternal and child health. Of course, these are young people. It's people who are young that give birth. It is people who are young that raise children, and it's people who are young that are involved in all those, a lot of behaviors, social,
Crisis.
activities, sometimes unsafe sexual practices. Okay, so now the theme for this year, realizing the hopes and aspirations of young people for today, focuses on the health of young people. What are the things that affect young people? If you talk about young people, these are the major things that we talk about. Okay. Sexual, reproductive health, okay, maternal and child health.
Okay, so because I wanted to find out more of the peculiarities of these health challenges of the youth, and you've talked about the reproductive health, the sexual health, and all the likes. So now, with the sexual behavior affecting the reproductive health and all the likes, how do we now look at the population and in the future?
Yes, that question is very critical. It's a very important question, and ironically, not so many people can project into the future with what is going on. Okay, now we have, like I mentioned earlier, we have in some countries fertility rates dropping drastically. Okay, the average recommended fertility rate usually is about 2.1. Okay, that means every couple should have about 2 children or thereabout. Of course, the 0.1, I mean, they cannot be 0.1 human being, but it's a figure. Okay, now that is an average. Unfortunately, there are parts of the world where women live, or men, or even couples live their lives all through without even conceiving and then without even giving birth. Okay, so what that means is time will come when such populations would have to go and get their workforce from elsewhere. Well, I will surprise you by saying that that time has come, because there are countries, as we speak, there are countries in Europe that depend on migrants or immigrants from other parts of the world to man their workforce. Okay, if we come to Africa, it is somewhat reversed. The fertility rates are higher. Unfortunately, the population is one that is not realizing its potentials and aspirations. We have a growing population that is not productive, that is not realizing its potential. So eventually, again, it is catastrophic. So you can look at it that if these young people have not been allowed to realize their potential, even as far as reproductive aspect of life, time will come when the workforce will suffer. Then if again they go ahead to realize some of these things without being checked, there's no check to these things, and then they involve themselves, we have, a lot of issues. Teenage marriage, teenage pregnancies, where I have seen, I was mentioning, I think some time ago, even in this platform, I have seen a 28-year-old who came with her 9th pregnancy to deliver. At 28, she got married when she was only a teenager. Okay, this lady was not educated. Okay, of course she's a young person, not educated, didn't go to school, she doesn't have any trade. Of course, she was busy giving birth now. There was no, space. Unfortunately, as at when she came, she was even malnourished. She was anemic. Okay, so these are things that border around young people that this campaign seeks to address. Unfortunately, we have to be running up and down, getting blood for her, because as she was giving birth every 1 year, 2 years, there was not enough time for the body to recuperate, for the body to heal, for the body to prepare for the next journey. Okay, so the essence of this is to create awareness, to create campaigns, let people understand that young people have aspirations, young people have potentials that they need to realize, and that it is a collective responsibility of government, of individuals, of societies, families, to help young people attain those potentials for the good of the community, for the good of the society, for now and for the future.
Okay. That's quite interesting. Okay, accepting this, that it is our collective responsibility, but the youth are vibrant, they are full of energy. So the youth, their sexual, reproductive well-being and all the likes, what are some of these daily lifestyles or practices that will now affect the youth?
Okay, daily lifestyle or practices. I would want to a bit maybe digress and just lay a foundation.
Okay,
When we say reproductive health,
well-being.
now WHO, World Health Organization, defines health as a state of complete physical, mental, and social well-being of a person, and not merely the absence of disease. Not merely the absence of disease. Now, if what that means from that definition, what that means is if I don't have money, and that is the reason why I cannot achieve anything, I can be said to not be healthy, in quotes. Okay. Now, when you bring this definition now in the context of reproductive health, you would see that you would say reproductive health is the state of complete physical, mental, and social well-being of a person, as long as it relates to matters of health and reproduction. Okay, what that means is this person healthy to reproduce? Does he want to reproduce?
Okay.
Does he have a safe enabling environment
To reproduce.
And when he does, whoever he produces is the person taken care of. Now, at the end, the end point of this isn't exclusively for now alone, but even for the future. Remember, we said realizing potential today and for the future. So we're looking at even the future. Now, practices that hinders people, from realizing those potentials. I would say that apart from the practices, there's first of all an economic failure. Okay, the biggest elephant in the room is the fact that people don't have the economic fair playing ground. Now, I'll give you an instance. I saw on my social media just a few days ago, a young woman came and posted that she said young people are now getting to 40 years of age. Young men are not married and they are not even bothered. So she was worried. How can young men be getting to 40, and then they are not getting bothered? And then somebody now responded in the comment section. He said, lack of funds. I mean, okay, we get to 40, we don't get to married, and it is because we don't have funds. So you can see the socio-economic factors. Okay, we have people who, because of economic reasons, some are even graduates. They are graduates, yet they cannot have anything of their own. They don't have jobs. You can see unemployment. It's a very big problem. They have gone to school, they have studied, they are fit for employment, but there are no employment. So unemployment is one of it. Poor, socio-economic status. Okay, lack of entrepreneurial skills. Okay, then even cultural norms. Okay, there are parts of the world where you get to 18 or thereabout. Sometimes you leave your father's house, but we see people who in their 30s, in their 40s, still staying with their parents. I mean, you may want to challenge that. Okay, you want to take care of your children, even if no matter their age and all of that. But of course, that person is supposed to be a young person. He is supposed to be in his productive years. He's supposed to attain potentials. He's supposed to, bring out what he has, and he remains. So these are some of the cultural factors. Okay, then we have harmful lifestyle practices, substance abuse. Okay, we have scenarios where our young people are involved in a lot of things. You keep wondering of reproductive techniques, assisted reproductive techniques. We now have people going about distributing or donating their eggs. Okay, now coincidentally or ironically, God has made the human being so unique, such that a woman enters the world with so much value. Okay, she has a number of eggs that eventually she would may get fertilized and then become her children. Unfortunately, we have our young ladies going about. Now these are things that would eventually, if you look at it collectively, they would hinder the actualization of this potential we're talking about. We are hoping that one day, when I get old and I'm retired, I would have another person who is a doctor, who is young, who will take care of me. But what if the person never gets born? Maybe because of some behavior that some people get involved in, or maybe because of some socio-economic factors, unsafe abortions. We have a lot of our children involved in abortions, and these are potentials, right? Every baby that is aborted, it's a potential precedent. So you can see how these things are going. So eventually, these people are not realizing their potentials, and then the devastating effect is coming on us now and even in the future.
Wow. So the issues are many that surrounds the youth, their reproductive well-being, their reproductive health, and everything that has to do, because we're looking at the future. We're looking at the population, in the near few years to come, not just for the now. But looking at the effect of social media, the myths concerning reproductive health, sexual life, and all the lies. There are a lot of things that are free over there on the social media. So, what are some of these myths that is pushing us not to actualize it, to actualize these potentials?
Okay. Social media is a very big problem on its own. So we could spend the whole of today talking about just social media, and we'll still not be able to exhaust it. Now, I would say something. I would say a story. A cousin of mine told me recently, just last week. He told me that one of our nephews is involved in Yahoo. A 16-year-old boy who just finished secondary school. Okay. He told me that, hey, this boy is into Yahoo. And I said, how can you tell? He said he saw him somewhere, they met somewhere, and he overheard him talking over the phone, discussing Yahoo, how that they have tried to dupe somebody and ask him if it has paid. And he now collected his phone, and then he went through, and then he saw some of the applications they use for Yahoo in the boy's phone. So what it means is he has something to hold on to, say this is an evidence that this boy is into Yahoo. And he now told me something that the boy once told him, that he's just praying for the day he would go to the university and have his freedom. Okay, so you can see this is headed somewhere, right? Now what it means is this boy has connected with the wrong people. Now, who or what source gets this connection? It is social media. It is usually through social media that young people get initiated into very harmful life practices. Okay, some happen in school, some via social media, and unfortunately, there's not so much regulation of social media. People go there and say anything they want to say. Okay, people go there, somebody goes there, he eats food and is happy, and he says anything, whether or not that is correct, he just says it and it goes. Somebody who is innocent and gullible comes and picks that up and says, so this is how this thing is, and then he goes with it, not even knowing that, okay, this wasn't even given by the right person. The person who gave this may not even be in a good state of mind. He may also even be under the influence of, Then there are a lot of things going on in social media. There are some groups that are harmful. Okay, there are groups where people go to learn Yahoo. People do a lot of illicit sexual content and all of that. So these are things that, now imagine a young woman who supposing probably should be in the university, okay, studying accounting maybe. Now dancing half naked. Everybody who has a social media account used to get paid. Some have the social media account, they just go there to waste their time. So eventually their time is going away. They are not really realizing their potentials. What can we say about the future of those people? We will not say it is bright. Because when you are supposed to be building for the future, you are there enjoying, gisting, chatting, watching videos and all of that. Of course, we would say confidently that there's no hopes for you that you are going to, we are not hoping for you to realize anything. You will not realize what you have not worked for. Okay, so I think, and then the like you said, the myth, the perception that people have is that we can get anything we want through social media, which is somewhat true. And truly, I would agree.
Because there are a lot of online medical people that are there on social media.
A lot of them even giving the wrong information. A lot of them, I saw one that was advertising sexual product. He said if you buy this one, he's going to enlarge his manhood. He's going to be, and then you see comments, young people. I mean, this is so important to people that they will not even look at other things to focus on. You are so important about sexual life. And then the sexual life we're talking about is not for productivity, it's not for companionship, it is just for fun. Okay. Because we're not talking about people even planning to settle down. Now
let's take a break. we'll come back. Yes, so this is Healthcare Live from the Plateau Radio Television Corporation here in Jos, and we will take a break so that when we come back, an opportunity will be given to you so that you'll be part of the discussion. You can ask your questions, you can make your own comments with this important discussion that we are doing. We are not settling for the now, but we are looking at our reproductive well-being in the near future. So let's take this time out. Yes, I'm glad that you are keeping faith with us on Healthcare Live from the Plateau Radio Television Corporation here in Jos. And in case you are just joining us, we are looking at the youth and reproductive well-being, and we're bringing it together with the World Population Day that was marked on the 11th of July. What does it hold for us? And our guest is in the person of Dr. Ayuba Namang Jehu. He is a resident doctor, anatomic pathology and forensic medicine, Jos University Teaching Hospital, and the public relations officer of the Nigerian Medical Association, Plateau State Branch. Yes, so we'll take another break and we'll come back. Yes, you are welcome back, and we are sorry that we had to keep you for those a few seconds, but we are glad that you are still together with us. And like I was mentioning, that is our focus, like you can see it on the screen, and our number is already there on the screen: 0906 1910191. And when you call us, you know that we'll definitely love to know who is calling, where you are calling from. So we'll expect you to give us a call so that we will be of greater help. And so I am Rebecca Giot, your host. So as we expect your calls, okay, doctor.
Yes, ma'am.
Okay, let's see who is the first caller. Hello? Hello? Okay, you can still call us back if you have something better. Don't just call and drop, because we love to hear your own thoughts concerning this. So like we're looking at it, the well-being, the reproductive, and all the likes. So now, how can these young people be adequately informed? Hello? Okay. So how can these young people be adequately informed concerning their decisions about their sexual life, about their reproductive well-being? Hello? Yes, who's on the line? Hello? Okay.
I'll go ahead and answer the question. How can people be informed?
Yeah.
I think it is important that we all know that it is a responsibility of everybody. First and foremost, the family. Okay? Where we are going to have parents being intentional about the reproductive well-being of their children. And what that means is educating this child from as early as possible. Okay? Educating them about their reproductive organs, educating them about who they are. Are you a male? Are you a female? This is what is expected of you. This is what you should do. This is what you should avoid. These are the things that would make you. These are the things that would mar you. Okay? Now, when parents are intentional, they will create the right and the enabling environment, for these children. Then, of course, educating the children again on hygiene. Okay? Now, apart from personal hygiene, educating them again about sexual hygiene. Okay? Because why we do have a lot of unsafe sexual practices happening is because people don't even know what is supposed to be the normal. Okay? But then people understanding and having a background knowledge of what a sexual hygiene should be, it gives them the first advantage to begin to have a background on which they can build on. Okay? So parents, number one, and the families. Then secondly, our schools. Okay? I'm aware that in school there are personally I have been to schools where we created awareness, to children, especially teenagers. Okay? They're educating them about signs of puberty. Okay? If you are so age, these are the things you see. Okay, you begin to notice these changes in your body. And this is what these changes mean. If you notice any abnormality like this, so they should know what to expect. They should know what is normal. They should know what is abnormal. Then they should report the abnormal. Okay? Then even our government, we can ensure that policies are set in place to ensure that, our young people are healthy. We are aware that young people now have access to contraceptive pills and other means of contraception. Okay? I mean, why would a 16-year-old or a 15-year-old single lady be carrying an implant all over the place? This is happening. Okay? This is happening. So, educating people, well, yeah, contraception is good. Okay? But for the right reasons, the right platform.
Yeah.
Okay, when we have people who uses it without control, without knowing or without having a good indication for its use, what about the side effects? Okay, are we ready, or are these people even aware that there are side effects of these things? Okay, so you can see everybody has a role, and then even the people concerned also have a role. Oh yeah, now you have phone and you have social media. What are you using your phone and your social media for? Just to watch YouTube, to watch dancing videos online? Or do you also use it to seek information about yourself, to seek information about your health and what it should be? So you can see that everybody has a role, starting from the people we're talking about, starting from ourselves, in other words. Okay? Then to the people we relate with, relatives, like the other person we were talking about that is into Yahoo. Chances are that he may be into substance as well if we are not careful. Because the same people who would influence him to go into Yahoo have a tendency to influence him to start taking substances. Okay, and then we have seen issues. I have seen a case of infertility simply because the man was smoking. He was a chronic smoker, and his wife could not conceive. And after some years, he got angry. He wanted to chase her out of the house. Eventually, after a lot of back and forth, when she comes to the hospital, Madam, please, I want you to come with your husband. Please come with your husband. Please come with your husband. Eventually, she succeeded one time and brought the man.
Let's see who is here first. Hello? Yes, who is on the line?
Okay.
That
So
example,
eventually the man came to the hospital and we got interacting, and we had to do a seminal fluid analysis for him. He was able to produce the sperm, but all the sperm cells are dead because he was into substances. He was a chronic chain smoker. You can see how this thing, even infections. Okay, the testis is a sanctuary site. Okay, if by some unfortunate means these infectious agents find their way into the testes, they would affect sperm's quality. So we're talking about infertility, and infertility affects any couple. I tell you that no couple who have failed to attain fertility is happy. Okay, maybe eventually if they get to adopt, okay, but then for that time being when they are still looking and hoping, it's not usually a funny thing. Okay, of course, if we have infertility, what it means is we are eventually having a decline in the population. Instead of having a plus, we are not having a negative. In the long run, it will tell. Okay, so you can see some of the issues we have bothering about the issues of
reproductive health and population.
Yes.
Okay, you said the first point of contact for this education should be from the family. And culturally, it is a taboo to begin to talk to your boy or to your girl about reproductive. That means you are encouraging promiscuity.
Okay. Okay. Um, there was an Israeli defense minister that mentioned something. He said, "Give me a child for the first 7 years of his life, and he will be an Israeli forever." It's what he means is, if you give him a child to be in his custody for the first 7 years of his life, after 7 years, take the child away. Tell him anything, insult whatever, he would always trace back. Then, for those who are Christians, the Bible says, train up a child in the way he should go, and when he grows up, he will not depart from it. What does this? What this tells us? And then in philosophy, I'm just trying to come from different perspectives.
Okay.
In philosophy, there was there was a concept of the early philosophers. They say that the brain, they refer to the brain as tabula rasa. Tabula rasa is a Latin word. Is it either Greek or Latin for plain tablet? Plain, then they don't use paper.
Yeah.
Maybe if it was now, they would have said plain paper.
Paper.
But then it
Tablets.
was plain tablet. If you have a plain paper, you that has the paper in your hand, it is up to you to write what you want to write on it. In other words, if you write good, you will see good. If you write bad, you will see bad. Now, these early philosophers classify the mind of a child as a plain paper. Okay? In other words, it is up to you to fill the paper, that's the mind of that child, with the right information. I put it to we and everybody that if you don't bring up the child in the right way, because you are afraid to say the things that you only say in the bedroom, the world will tell the child. Unfortunately, the world will tell the child the wrong thing. And that wrong thing that first enters the child's mind is the one that would stay. Okay? So you would confirm the words of the Bible, what the Bible say. You will also confirm what the Israeli defense minister say. You will also confirm what the philosophers said when they say the mind. So we have an opportunity. In fact, it is even a gift to be a parent, because there's so much impact that one can make in the life of his child. Okay? And I think parents would have to find a way of doing this. Okay? It could be that, I know from what you're saying, it may not be appropriate for a male parent to call his female, children to educate them. But the female parents can do that. The female parents can sit down with their, and of course, when you create that bond of friendship, why not? Talk to them. Okay, you are growing up, you are my child, I want the best for you. Okay? I will tell you what I've experienced when I was your age. These are the things I saw. These are the things you are going to like to start seeing very likely. This is what will happen. These are the people that will be coming for you. This is why they are coming for you. Okay? And this is how you should go about it. If you don't do it, I bet you the society will do it. Unfortunately, the society may not do it well. Okay. And then it becomes a problem eventually.
Thank you. So now, in line with this, we have outlined all the things that we need to talk about, the consequences, the things that accompany these issues. So now, investing in this youth reproductive, well-being, is there a benefit to invest in it, their sexual and reproductive well-being?
Yes. In fact, the benefits would surprise us. Okay, let me just go back to China. Earlier I was laying the foundation and I said that in China, they made regulations, that's in previous years, as to how many children a couple can have, the maximum number of children that a couple can have. Then eventually it got to a point that, and that was because their population was so outrageous, and then the resources were not enough to take care of the population, the growing population. Now, when they made regulations, the dynamics now changed. They now have elderly people and fewer young people. And they are thinking, Kai, we will get issues. As big as our population is, it will surprise us that the population will get to a point that it will be depleted. Because when people go old, they die now. Okay? So now, what do? They now decided that, see, we need to encourage the young ones. And of course, as if the young ones were not there. They were there now, but they were not reproducing. They have now become more educated. They have more access to family planning services. Then, what's the point if I could just be free and enjoy my life? Okay? Now, their own government has now brought in policies in place again to give incentives. If you want to settle down as a couple, there are certain benefits There are certain things for you as a couple. We're going to give you a home, we're going to give you a car, we're going to give you certain funds to start up the family. Okay? That way, the goal of not having a depleted population is still maintained. Eventually, they would still have their workforce. Okay? Now, when you bring it to Nigeria, there is really a need for us to look at it. Because, unfortunately, well, I didn't say that in Nigeria, we have two contrasting parts of the country. Fertility rates are high in the north, and then the resources, not that the resources, but the fertility rates are low if you go south. There's a sharp decline the moment you leave northern Nigeria going down south. Okay? And that is again due to some factors. I give you an instance. In the north now, we have people going into early marriages. Okay? Young ladies who have not achieved certain aspirations. So we see people who have the population, but they are not as productive as they should be. Okay? Then we go down south, we see people who are more productive, who do not have the population. So you can see that there is a need for balance. In as much as we want to still have the population, we still want to have a good and fair, fertility rate. We also want the population we have to be as productive. We don't want to have a young woman who becomes a baby factory and she is not productive herself, except for there are other potentials that a person can achieve apart from just being productive or apart from just giving birth to babies. Okay? And of course, even the men, some men, and it's just family, they just want to give birth to, or they want to get married for as many children as possible. Okay? Then there's a need to reorient again, to shift the focus from just chasing career to let's have a support system to establish families, because we are hoping that we are going to have manpower from you. So when the government begins to look at it that way, that see, we are going to apportion a certain part of our budget as a country into the health and well-being of the youth as far as it concerns reproductive life, so that one day we will not have a population that is not productive, or so that one day we would end up not even having the population of young people. I think if government starts thinking that way, it's a very good thing. That way, we are able to attain a balance. We are able to still maintain some fair fertility rates. Unfortunately, if our fertility rates decline now, we may not be as fortunate as Europe. Europe is developed, and that's why people from Africa would go there to go and work and get something for themselves. If Africa is underdeveloped, if Africa have low fertility rates, and then we have a depleted workforce,
Who will come?
who will come?
Okay.
Because we are not even developed.
Okay,
So
thank you.
people don't even want to come, because what do you have to offer them? Okay, so I mean,
Okay. Yeah, so in parting, what will you leave us with concerning the youth sexual and reproductive well-being?
okay, I would say that the world population has a lot of dynamics. In some parts of the world, the fertility rates are declining. In some parts of the world, the fertility rates are high. Unfortunately, the fertility rates that are high are not necessarily productive. And we as a people, as a government, as individuals, as families, should be intentional towards maintaining a fair fertility rate and towards maintaining a productive population. How do we do that? By focusing on the health, by promoting the health, the reproductive health, or the sexual and reproductive health of young people, because these people are the ones that will reproduce the future for us. These people are the ones that will man the workforce for us, even now and in the future.
Thank you.
So, thank you very much.
Yes, the youth are in the now and the youth are in the future. If they are not productive, we will have issues with our reproduction, in the next few decades, and that is why their well-being is very important. This population that we have is a population that must be maintained, looking at the health and the reproductive well-being, the sexual life of the youth. Yes, we must look at a way of making sure that we do not do anything that would affect you, bringing forth another person that is full of potentials that will carry on. So that has been the focus today as we have looked at the youth and reproductive well-being. We told you that it is together with the population, World Population Day on the 11th of July. So on that note, I sincerely want to appreciate Dr. Ayuba Namang Jehu, who is a resident doctor, anatomic pathology and forensic medicine with the Jos University Teaching Hospital, the public relations officer of the Nigerian Medical Association, Plateau State chapter. Indeed, we are very, very grateful.
Thank you for having me.
Yes. And thank you to all of you. Some of you tried to get to us. You couldn't. Some of you just dial and drop. But know that we are always here to hear from you and to also get you contribute on the program. So on that note, on behalf of the entire production crew, is yours sincerely, Rebecca Jot, saying goodbye and God